Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar where we talk about Lyme disease. No 2 weeks are ever the same because you create them with your questions. So I'm looking forward to seeing what you've developed for me tonight. I see a number of questions that have already been written. If you want to know how to write those questions or where to do it, over here on the bottom of the screen on the right-hand side is a chat box. Write your question to me through that chat box, okay? Now, the one thing I ask is this format works best for shorter questions. So if you're starting to write super long ones, realize I may not be able to post them or answer them. I try to answer ones that I can actually post on the screen, but if they get too long, it literally locks up my side of the screen, okay? So during the webinar tonight, as I post those questions, I am going to be reading them. And the reason I do that is in the recorded version, you cannot see them. But in the live version, they actually do show up on your screen. And so you should be able to follow along with what I'm seeing. You'll be seeing the same thing, okay? Now, for those of you that are new here, welcome. I'm glad to see some new faces. We also have a large number. We also, it's like my Siri started talking to me there. We also have a large number of people returning. So I'm glad to see that you all keep getting some value out of this as well, too. Tomorrow morning, I will be sending out an email with a link to the recording. So yes, we are doing a recording tonight, as I try to do each time. And as long as there's not a huge technical failure, we'll be able to go ahead and get that recording out to you by around 9 to 9:30 in the morning tomorrow. That email will contain links in it to the recording, and also that email will contain a link to sign up for the next webinar next week. Okay. Now, if you happen to not get that email, there's a number of places that you can find a copy of my webinar recording. So one, you can go to treatlyme.net, which is my Lyme disease information site. Go to the webinars page. You'll find a recording there, okay? You can also go to my supplement store, which is Marty Ross MD supplements. That's at treatlyme.com. And that on the homepage there, you'll also find a copy of the recording. And then finally, you could also go to the homepage of my practice website here in Seattle, and that that URL for that is martyrossmd.com. All right. Now, probably in the course of the webinar tonight, I'll actually show you those websites so you can actually see them in person as well, too. Okay. All right. So with no further ado, let's go ahead and get started here. First question is from Bill. Hello, Bill. Let's see. Hello, Dr. Ross. Is there benefit to doing the Galaxy testing for Bartonella? If you are having clinic signs that point to Bart, are you not going to treat it if it comes back negative? Thanks. So everyone, Bill raises an interesting question. So Bartonella, as many of you know, is another infection you can get from a tick bite. And sometimes it is transmitted with Lyme germs, and sometimes it can be transmitted on its own. Bartonella does not only get to us through tick bites, it can also get to us through mites, fleas. I believe biting flies can transmit it as well, too, and then ticks can, too, okay? So it's possible to have Bartonella infection just on its own. The issue with Bartonella is our testing, even through a high-quality lab like Galaxy Diagnostics, which is based out of North Carolina, it's difficult to find Bartonella, and here's why. So we think that there are, or we know that there are 28 strains, of which 15 can infect humans. The other ones affect various animals, okay? And of those 15 that infect humans through a standard lab, like a LabCorp or the lab you would go to through your doctor's office, we can do antibody measurements to see if you have one or two strains. And the common strains that can be tested for by most labs to see if you've made antibodies against them, one is called Bartonella henselae, another one is called Bartonella cantana. Okay, so those are easy to find through standard labs. However, we are now starting to see that people with Lyme and not with Lyme are infected by multiple strains, up to 15 of them, okay? And there isn't a lab that tests for antibodies against all 15. IGeneX is now doing a test, a Western blot, that looks if you have antibodies against, I think, 4 or 5 strains. What Galaxy Labs is doing is they have a different test technique, and that is that they are doing what is known as a PCR test. And a PCR means they're looking for the DNA of the germ. and they have the ability to detect the DNA of 15 kinds of Bartonella. So all those 15 strains that can infect you, okay? So that sounds like it would be really great. It seems like everyone should be getting their Galaxy lab, or the Galaxy enhanced PCR for Bartonella test to see if you have Bartonella. But there's a problem. And that is that we don't really know. They've never been able to do a test where they know for sure of all people or of known samples that have Bartonella in them, what is their ability for their test to find it, okay? And one drawback to doing a PCR test is that the germ has to be swimming by the needle at the moment you draw the blood. And a lot of these germs, like Lyme, and in this case, Bartonella, are not necessarily living wild in the blood. They're out in their tissues creating the mischief and problems that they do, okay? So if you draw a PCR test and it comes back positive, great. You definitely know that that's what your problem is. But if it comes back negative, it doesn't exclude having the illness. So overall, with all of these tests, and I think that Galaxy still is probably the best test out there, but with all of these tests, having a negative test does not exclude the illness. And that's the point that Bill was making. So in my practice style is if I have a person that has a lot of symptoms that suggest Bartonella or key symptoms that suggest Bartonella, I'm going to treat them for Bartonella anyhow, even if they get negative testing. So I generally am not going to do the test. All right. Why waste money? If you're going to go ahead and treat for something anyhow, why do the test? And in general, in medicine, a lot of physicians will take the viewpoint that you only do testing if it's going to change what you're going to do. Okay. And in the case of somebody who has a lot of symptoms of Bartonella, we're going to treat anyhow. Okay. So I don't routinely do those tests. All right. So what symptoms make you think of Bartonella? So the symptoms that suggest Bartonella are pain on the balls of the feet. It's usually a pain right at the ball of the feet that gets better as you start moving and walking on it. Often you can walk it off, okay? There's also a large number of neurologic and psychiatric symptoms that can happen with people with Bartonella. So neuropathies of any kind, which means nerve injuries of any kind, tremors. Some people with Bartonella have this syndrome where they have this a feeling of internal vibrating or shaking. Even if you look at them, you don't see it, okay? Bartonella can give seizure-like disorders. And on the psychiatric realm, Bartonella can give a lot of anxiety, depression, dissociation, hallucinations sometimes, okay? Bartonella is known for giving a rash that looks like stretch marks. Bartonella can give a lot of swollen lymph nodes at times, okay? And so these are the kind of symptoms that make you wonder about Bartonella, and especially if there's a lot of neurologic and psychiatric symptoms, I'm probably going to cover for Bartonella in my treatments, okay? All right. Thanks for that question, Bill. I'm just going to do a quick screen share, everyone, so you can see where you can get more information about what I just talked about. All right, so this is my medical practice website. Here is our my Lyme disease information site, Treat Lyme by Marty Ross MD. And if you're trying to find information about how do you diagnose Bartonella, take a look at my section, which is called How to Diagnose here. And take a look at my article called How to Diagnose Bartonella in Chronic Lyme Disease. And in here, I review the symptoms, and also I review the testing options that you have as well, too. Okay? All right, there we go. Bill, thank you for the question. Good luck to you. Hello, Karen. Let's see. Hello, Dr. Ross. I don't know what I would do without your webinars. Thank you. Well, you're welcome. Let's see. I was diagnosed by Dr. Rexlin in 2018 and began IV antibiotics. I went undiagnosed for 26 years. Do you see Lyme patients with pain-induced rage and psychosis-like mood swings? Symptoms seem to correspond most closely to MS-like descriptions, but with musculoskeletal rigidity causing dystonia-like chronic contracture of muscle groups together with orthostatic hypotension with occasional partial to full blackouts, but with all muscles and limbs feeling sclerotic, and pain like electrical live wires, pain from the bones out, cranial, sacral, neck, and scapula, IT bands, rotator cuffs, abdomen along the pelvic bone, just everywhere. All symptoms most severe in the morning, and recoiling of muscle and connective tissue occurs frequently, most severely after myofascial release bodywork, self-therapy, and even during magnesium salt baths, and lighter bodywork. Conopin seems to help with pain, but by no means takes it away. Can you help me? So I thought there was going to be a question about what ideas, but that can you help me? I think I would have as probably good a chance of helping you as Dr. Laxland does. I think he does a good job. He obviously, given the type of symptoms you have, he's focused on IV antibiotics. It's possible you may get a better result with that. The other thing that I could add to what he's doing is possibility of adding in some supplements to help with the repair, with what's happening with you, and to deal with some of the contractures and some of those issues. But I don't know that I'd be able to help you any more than him. He's a pretty good doctor too. So, but if you are interested in looking at what options I might have for you, what I'd suggest doing is to set up an online consult with me. It's a service where I visit with people online from around the country. But because I don't get to examine you because it's an online visit, I do not actually write prescriptions, nor am I able to write tests for you, but I give you information that you can share with your physician or that you can do on your own in terms of supplements to help the situation. So if you're interested in looking at something like that, so let me just show you where you would go find that information and where you could do that. All right, so you would need to go to my practice website, which is martyrossmd.com. Take a look on my appointments page. And from here, you can actually set the appointment up by hitting the Book Now button. But you want to read all the way down here about what do I offer in a limited consult service, okay? Here I talk about the range of things that we can and cannot do. And here I also describe and have forms that you would need to fill out, okay? Let me go back here. So to answer your question, yeah, I think I could help you, but I'm not sure that I could do much more than what Dr. Laxland is doing for you. I might be able to get a little bit more into some of the alternative medicine supports and natural medicine supports than he does, just knowing how he works. But yeah, so I hope that answers your question, okay? But if we do the consult, I might be able to look in that a little bit more and ask you questions so I can define a little bit more about what ideas I might have for you. Okay? All right. Good luck to you, Karen. All right. Hello, Trevor. Let's see. Hi, Dr. Ross. Hope this finds you well. I am. Thank you. I am curious, knowing your stance on EpsteinBarr and Mycoplasma, what you do for someone who has Lyme and co-infections, but showing mainly, I think ME, you mean myalgic encephalitis, PEM symptoms. I'm not sure what you mean by PEM. I prefer that people don't use acronyms because I don't know if what you mean is what I mean, okay, or initials. I just got my Mycoplasma results back, IGM negative, but IgG through the roof at 1900. Also, over a year of treatment, my symptoms have gotten much better, but my EBV, which is EpsteinBarr, and NKA levels went up. Do you have a potential explanation for this? So NKA, I'm not sure what you mean by that. I would need to see actually what that means. Okay, but let me make a brief comment. So what Trevor is noting is that I am not a big proponent of treating for Mycoplasma and Epstein-Barr virus based on elevated antibody levels. And I want to explain why. So Mycoplasma and Epstein-Barr virus are two infections that we find commonly even in healthy people, okay? So finding elevated antibodies does not mean that they are causing any kind of a problem in a person, because healthy people live with them and they don't cause them any problems, all right? So if we were to pull 100 healthy people off the street and do testing, there's been testing that's been done looking at this, about 10 to 20% will have evidence of either Epstein-Barr virus, cytomegalovirus, a type of herpes virus, which is not sexually transmitted, it's called HHV6, or they might have chlamydia pneumoniae or mycoplasma pneumoniae, and they would have elevated antibodies against those, okay? So let's talk about antibodies for a minute. So we have two families of antibodies that deal with fighting infections. We have a family called IgM, and we have a family called IgG. And any infection we get, we're going to develop IgMs and we're going to develop IgGs, all right? Now, we develop IgMs first. They're considered to be the acute antibody. And eventually they go away, they get replaced by IgGs. When we make IgGs, they continue to help fight an infection, but they are also the memory of the immune system. So they never go away, all right? So just finding elevated IgGs does not mean that the germ is gone active, because we expect you to have IgGs after you've had an infection, all right? Now, some of my colleagues take the viewpoint that if the IgG antibodies are really elevated, it must mean the immune system is working super hard to get a germ that is out of control back under control, okay? That's what they theorize, all right? And so, but you could make another argument, which is the immune system is doing a great job. It's making elevated antibodies because it's keeping the germ under control, all right? So having elevated antibodies does not prove that a germ has gone active, all right? So in my practice, I generally don't focus on the viruses and even a mycoplasma unless I'm about a year, 2 years into treatment and we're making no headway. I'm going to start wondering, are they part of the problem? Okay. Now, why do I wait a year to even start thinking about them? Well, the issue is when you have chronic Lyme and you have Lyme disease in you, Lyme can lead to some degree of immune suppression. Okay. And that may make it more difficult for the immune system to deal with some of these infections that normally cohabitate with us. So that if you go after Lyme and you get it under control, by killing it, and you also do things to correct sleep, like I recommend in my Ross Lyme support protocol, and you lower cytokines, and you get yeast out, and you do all those steps that I recommend in the Ross Lyme support protocol to get your immune system working better and to get your Lyme germs under control, often the immune system is going to step in and get those germs that might be out of control back under control, okay? But by a year, if a person's not getting any better, I'm going to start wondering what else is keeping them sick. All right. And one of those things could be chronic active viruses, and the other one could be mycoplasma as well, too. Okay. All right. So, Trevor, I'm sorry, I just can't answer fully your question because I don't know what you mean by PEM, and I don't know what you mean by NKA. So I would need a little bit more of an explanation of that. But I hope that I at least answered part of that question for you and also for everyone listening in tonight. Okay. All right. Thanks for the question. Good luck to you. Hello, Kara. Let's see. If someone with Lyme and co-infections is having dental work done, filling cavities, are there any anesthetics that are contraindicated? I'm using only the herbs you recommend for treating my germs, no pharmaceuticals, and I assume none of them will react with local dental anesthetics for cavities. What do you think? So, Kara, I am not aware of anyone having reactions for using dental anesthetics, local dental anesthetics, with any of the herbs that I recommend, okay? Now, having said that, there's a Marty Ross rule in medicine, okay? And that is anything can happen to anyone with anything, okay? So there are the common side effects that happen to a lot of people, and then there's what happens in individuals. So yeah, there can be a rare chance that something might happen. I can't say absolutely 0%, but I would say in general, I never see reactions with anesthetics with these, okay? All right, good luck to you. Hello, David. Let's see. Dr. Ross, thank you for continuing the webinars. They're extremely helpful. You're welcome. A couple of questions. I have dealt with Bartonella. Aside from the telltale scratch mark symptom indicator with Bartonella, what are the signs you, in your practice, find most common with Bartonella, considering blood tests are unreliable diagnosing Bartonella? Lastly, is muscular numbness and slight tingling after exercise considered being a symptom of Bartonella, Lyme, or another tick-borne illness? All right. So David, I answered a large part of this question earlier when I talked about testing and I talked about the symptoms already. Okay, so if you happen to have missed that earlier, listen to the recording tomorrow. I don't want to take time to go back over all those again. Also, you can take a look at the article I wrote about how to diagnose Bartonella that you can find at treatlyme.net. Okay, all right. But to the last part of your question, is tingling after it's numbness and tingling after exercise a symptom of Bartonella? It could be. I probably would not use it as the only symptom to diagnose Bartonella. I would want to see that there are other symptoms suggesting Bartonella, like I discussed earlier. Okay? All right. Good luck to you, David. Oh, the other thing it could be is it could be injury from, it could be Lyme, can do that too, okay? And the other thing is, even if Bartonella is gone, sometimes there can be injury from having had the infection as well too. So I would want to see other symptoms suggesting that it's still active, okay? All right, good luck to you. Hello, Isa. Let's see. My friend Chris has been taking Hutania, Sidacuta, Cascala, for Lyme and Bartonella. He has had a lot of symptoms before and after starting, and we're having trouble figuring out when it is a Herx reaction versus a flare-up. In particular, he is having strong feelings of depression, anxiety, and irritability and periodic vertigo that he didn't have before he started the protocol. I thought specific symptoms like these were caused by the bugs invading different parts of the brain, organs, etc. It makes sense to me that spirochete die-off causes a worsening of general cytokine symptoms like fatigue, but I don't understand how or if it causes this kind of specific symptom. Could you please explain? It helps us weather this when we have an idea of what the heck is going on. Okay, so Isa, typically, Herc symptoms will be worsening of what we call cytokine symptoms. Okay, so what happens in a Herxheimer reaction is as we start killing germs, the immune system will react against the dead bug parts. Okay, all right, and it will react by making more inflammation chemicals, which are called cytokines. Cytokines, when they're in excess, give you fatigue, make you hurt all over, can make it difficult for you to think. And sometimes excess cytokines can sometimes even trigger depression or anxiety. And that anxiety and depression then can trigger more cytokines, and you can kind of get into an endless loop, okay? So classic symptoms of a Herx reaction usually are going to be more fatigue, difficulty thinking, and body pain. Those would be the big ones, okay? Occasionally, you might get worsened mental health problems as well too, but it's not that common, all right? All right. The other thing a clue that helps you think of whether it's a Herx is a Herx reaction will occur near the time you start a new antibiotic, whether it's an herbal or prescription, or within a day or two of increasing a dose, okay? But if you're stable on your doses of herbal or prescription antibiotics, and then suddenly you start getting depression or you start getting more body pain, that is not a Herx, okay? That could be something else, okay? And then finally, part of the difficulty in all this, and Isa, it can be difficult to tell, and frankly, you just may need to talk to your provider, and I know who that is, but you may need to talk to your provider and see if they can help you sort it out, because there are times that anything we take can give side effects, okay? Now, although I would not think of depression, anxiety, irritability, and vertigo as being symptoms of a side effect of any of these herbs, it still is possible. And then lastly, those symptoms of depression, anxiety, irritability also could indicate that Bartonella is getting worse, even in spite of using herbal antibiotics, and that maybe it's time to start thinking about prescription antibiotic regimens too, okay? So these are all kinds of things to consider, all right? Okay, good luck to you. Good luck to your partner too. Hello, Stephanie. Let's see. Hi, Dr. Ross. I am in the PTLS, Post Treatment Lyme Syndrome category, bitten by several ticks first week of May 2019, meaning I took Doxy 3 weeks, Zithromax and Bactrim approximately 6 weeks, and Atovaquone for 5 weeks. Do you think most people with post-treatment Lyme syndrome have active Lyme infection, mostly have damaged tissue from Lyme that needs to heal, or have some type of sustained immune cytokine reaction? What are your recommendations for post-treatment Lyme syndrome patients? I'm currently taking Atoba and Cascol twice a day, just in case I have active Lyme. Thank you for your generous and kind work. All right. So bear with me here, Stephanie. I'll be glad to answer that here. Just bear with me a second. So all right. So let me just make some general comments here. And actually, to give you probably the best input here, this is a situation where I would want to talk with you more directly and ask you a bunch of questions to clarify things, okay? So I'm only going to be able to make some general comments here, but if you would really like a good level of input, an accurate level of input from me, I would suggest taking a look at my website, martyrossmd.com, where I have on my appointments page the option to set up what is called a limited consult visit. And I would set up probably a 60-minute visit so that I can just really ask you a bunch of stuff to help sort this out. It is true we might only need 30 minutes. I bill in 15-minute increments. So if you set up a 60-minute appointment, we don't need all of it. I would only bill you for in 15-minute increments for what we use, okay? So I will just start by saying I may not be able to sort out exactly what's happening with you here, but the best way for me to do that would be to talk with you directly, and we can do that in a consult. Okay, all right. So first of all, when we look at the best chances you have of eradicating a Lyme infection is if you can get on treatment very close to when the tick bit you. Okay. And that means knowing that you had a tick bite. So for a lot of people, the problem is they never knew they had a tick bite, or they don't. So I'll just throw that out. Okay. So what research tells us, the infectious disease doctors have new guidelines that are supposed to be coming out there in draft form. In their new guidelines, they're only calling for 2 weeks of antibiotics, and for that's if you have Lyme. And for an acute tick bite without immediate symptoms, they're only calling for a single dose, okay, which is ridiculous. Both of their guidelines are ridiculous, all right? But what we know from their old guidelines, where they recommended 3 to 4 weeks of antibiotics, is that about 15 to 20% of people would go on to develop chronic symptoms, okay? So that using 3 to 4 weeks within the first month of a known tick bite results in a 15 to 20% failure rate in ongoing symptoms, okay? All right. Now, I am in the school of thought that I think the majority of people that continue to have symptoms as you are, and especially if it's near when they had their acute tick bite, that this is probably ongoing infection. I think there's compelling science that shows for the majority of people that you can have ongoing infection. A lot of that science is ignored by the Infectious Disease Society of America and the Centers for Disease Control. And because they ignore that science that shows that you can have persisting infection, they are looking for reasons to explain why people remain ill. And the explanations they have come up with are either tissue damage or sick behavior. They call it sick behavior, where somebody psychologically retains all these symptoms, or it is due to an immune reaction that is triggered by the Lyme germ. I think the evidence, in my opinion, overwhelmingly supports the idea that for most people, this is chronic ongoing infection, okay? I will also let you know that at times I do, as part of my treatments, also play with the idea that for some people, their remaining symptoms, in addition to being ongoing infection, could be an immune dysregulation set up by having the infection in a person, okay? And for some people, yes, we do need to get some counseling interventions to help them process some of the trauma that they've had related to having Lyme as well, too, okay? So, but to answer you the most accurately, I'd set up a follow-up visit with me. One other reason that people sometimes can have ongoing symptoms after they've been treated is they may have had an infection that was missed. So those are called co-infections. One of those is Babesia. It does look like you had a Babesia treatment. I generally wouldn't consider 6 weeks to be enough for that, or 5 weeks to be enough. And the other one is Bartonella. Zithromax and Bactrim sometimes can treat for Bartonella, but in my practice, I'd never find 6 weeks to be enough to treat Bartonella either. So even though it looks like you have a practitioner that might have dealt with these other infections, I would suggest the treatment was too short. And that could be why, if you have ongoing infection, that could be why you have it too. Okay? All right. Good luck to you, Stephanie. Thank you for that question. Hello, Leah. See, how long do you suggest someone take low-dose naltrexone? I've been on it a year, and at this point, it's hard to tell if it's doing anything. Do you have to titrate off, or can you just stop abruptly? Second question, does BART or Babesia have Herx responsive like Lyme does? Okay, good questions. So everyone, low-dose naltrexone, or LDN, stands for low-dose naltrexone, all right? Naltrexone is a narcotic blocker. And so we use it. It was traditionally designed to treat people with drug overdoses, all right? Narcotic drug overdoses. And what it does is it binds to narcotic receptors in our body. And those receptors are also what are known as endorphin receptors, okay? Now, we, as humans, make our own narcotic system. We have a set of naturally occurring narcotics that we make called endorphins. And our endorphins actually not only regulate pain, they regulate our immune system, okay? And it has been discovered that if you provide a temporary blockade of those endorphin receptors using small quantities of naltrexone, that you can get a re-regulation of the immune system, all right? And so there's more, I could explain more how it works, but I'm just kind of giving you a quick summary of that, all right? My experience in working with low-dose naltrexone is if it is going to help, it should help by 6 months. I used to think you had to give it at least a minimum of 2 months, but I'm now more in the camp of 6 months based on some research that I've seen and also just working with it a bit longer, okay? So if you've done it for a year and it's not working, I think you could stop it. And you can stop it cold. You don't need to taper off of it, okay? All right. What gives a Herx reaction? So Herxes occur to certain conditions, of which Lyme is one. I usually don't consider people to get a Bartonella Herx. If they are Herxing when you're treating Bartonella, I think it's because some of the things we use to treat Bart, even herbally, may treat Lyme as well too. Okay, so I think it's more of a Lyme Herx. Treating yeast can give you a Herx. Treating Babesia can give you a reaction in some people, which I've never heard described as a Herx, and maybe it is. Maybe it's just some kind of a killing reaction. But occasionally what I will see in people with Babesia when we're killing the Babesia germ, especially when I use one of my high-dose artemisinin regimens, and I'll show you where you can read more about that. But in a high-dose artemisinin regimen, it's not uncommon after about the 3rd day of being on it that you'll get more air hunger and more sweats. About the 2nd or 3rd day into that type of a regimen, you'll notice it. Okay? All right. Lee, thank you for that question. All right, so if anyone is wondering what is an artemisinin regimen, let me just do a quick screen share here. All right, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD again. All right, and in terms of treating Babesia, take a look at my infection treatment plan section here and take a look at this article called Kills Babesia Brief Guide. In here, you'll see how various combinations I use to treat Babesia. The strongest treatments are prescription. I put those in a tier 1 category. I put my herbal options in a tier 2 category, of which artemisinin is one of those. And in here, I describe how I use very high doses of artemisinin, as I was just describing to you. Okay, all right. All right, let's see here. So I've got a number of people that wrote their questions twice. So if you see me stall, I see a name and I just quickly start to read the question and then I determine I've already posted that one. So let me get rid of this one. All right. Hello, Doug. Let's see. What is your view of how bad the impact of the coronavirus will be and how long it will take to play out? Good question. All right. So first of all, everyone, I am doing this webinar from the current epicenter of coronavirus in the United States, although I do know it's starting to spread into other areas. So I speak with some authority about this, okay? So first of all, if any of you are interested, I did post an article about coronavirus and people with Lyme disease. And in that article, which also includes a video that I recorded during the webinar last week, I describe steps that you can take to help limit your chances of getting coronavirus and steps you can take that might boost your immune system in a way that you might have a better chance handling the coronavirus if you get it, okay? So I'm not going to talk about those kind of comments here. I'm going to address more of Doug's question, which is the impact, how bad the impact of the coronavirus will be. All right, so first of all, and I'm just going to talk off the top of my head here, okay? So first of all, when we talk about impact of coronavirus, we're seeing it. I mean, here in Seattle, we're seeing it. I mean, our streets are practically empty because they have now basically shut down. All large companies are telling people to work at home. They have now shut down all of the schools. It's official today. Our Seattle public schools now are closed all the way through April. And basically what they're doing, and they've stopped all gatherings of 250 people or more, and they are encouraging people to not even go out to the bars. And if they go to the bars, to sit at least 6 feet apart, okay? So we are now getting into kind of a lockdown situation here in Seattle. And so in terms of impact on life, it's a huge impact, all right? It's difficult to go out and socialize on a daily basis. I mean, you get the idea. I mean, it becomes very difficult, all right? But what the problem is with the coronavirus, especially out here, is that we now estimate that it was wandering within our community unknown beginning on January 17th, okay? And we didn't start recording our first deaths of this until about 2 weeks ago, all right? So it was wandering out there with a lot of people not knowing they had it, spreading it to each other, all right? And if you look at what a possible death rate of coronavirus is, and I'm going to use for this calculation an estimated death rate of 1%. If in Washington State, we've now had, I think, 24 deaths is what they're recording, okay? And if a death rate is 24%, that means that's 24 out of a large number of people, resulting in a 1% death rate. That would mean of those 24 people that have already died, we should have at least 2,400 people in our community that have this infection, okay? And we haven't even recorded those numbers yet. So it's probably, as we start getting testing out here, we're going to find larger and larger numbers of people have it. And I think it's going to far surpass the 2,400, 3,000. I think it's going to be much higher than that because it's been wandering around out there quietly. All right. Now, I don't think it's going to happen like this in other communities because other communities are starting to get on board early and starting to do efforts to prevent the spread of this illness. Okay. So you see, in Austin, Texas, they already closed South by Southwest conference so that people are not going to be in large contact. And I believe in Austin, I've seen that they've even limited activities that have 250 or more people, just like we've done here in the state of Washington, okay? So there are efforts underway to try to prevent, mitigate how severe this is going to be. And I think we're probably going to be in the one more severe areas out here because I think the rest of the country is enacting measures already to prevent this thing from getting as bad as it probably is going to get out here. Okay, I'll just start by saying that, all right? So if we look at this thing, I'm going to look at the example of South Korea versus China. Okay, so right now you may read about death rates, and the death rates projected based largely upon what happened in China and now in Italy is that there is a death rate of about 2.4 to 3.4%. Okay, now I will tell you that's really high, and I think it's wrong. It's a false death rate. And that's because it's artificially elevated because we don't really know in those cultures how many people actually had the infection because they didn't do a lot of screening initially, okay? So if you correctly identify everyone that has the infection, not people that just got symptomatic, but people that have the infection, the death rate falls because you have dying per a larger population of people that actually got it, okay? Now, if we look at South Korea had got this thing bad, okay? Their rate of infection in the population skydived, or not skydived, went up dramatically, and recently has been skydiving down. And I think I saw 2 days ago, they only had 167 new cases, okay? What did they do in South Korea that worked? Well, South Korea did basically, they took anyone that got it and then immediately went out and tested anyone that person had come in contact with. And then I believe they even did a second degree of contact tracing where they took the person that came in contact with the person that got infected. They tested everyone that contacted them. And then they tested anyone that contacted that second person that might have been in contact, okay? So they did extensive testing because unlike our government and unlike our Trump administration, who really dropped the ball on this thing, they got out there and developed testing and went out and tested everyone, okay? So in South Korea, we now know what has happened out there because we can more accurately define who got it. The death rate is actually about 0.6%, all right? So in terms of impact, death is one impact. Is it going to be a 2.4 to 3.4% death rate? No. Once we've accurately defined who has this infection, a real death rate, and here in the States, we may not be able to accurately define it until we get antibody testing where we can go out and figure out who the heck actually had this thing, because we're horribly behind in developing adequate testing for this thing. We sat on our hands for months. We should have been, once we saw what was going on over in China, we should have had our test developed and in the hands of state officials right away. And here we are still farting around trying to come up with adequate testing, okay? That's my commentary. That's government not working. That is our president dropping the ball and other people around him dropping the ball. It's actually scandalous as far as I'm concerned, okay? But the point I'm trying to make with this is that the death rate is not that 3.4%. It's probably more of a 0.6%, okay? And the way to stop the spread of this thing is to follow South Korea's example, which is they locked down areas, they prevented people from coming in contact with others that might have it, and they adequately defined who had it, all right? What are we doing here in Seattle? We're doing the right thing. We're basically saying you need to stop coming in contact with people. So we're saying that if you are age 60 or older, or if you have heart disease or lung disease, those are the people that can be most dramatically impacted by this illness. They're the people that tend to have the worst outcome. We're telling those people, don't go out, stay in, okay? Don't go out, all right? And then we're also limiting the ability to transmit this among people by now not allowing gatherings of 250 people or more, okay? We're shutting down things because we're trying to prevent the spread. What we are doing here, we'll eventually get it under control in Seattle. You will still see for about another week or 2 weeks, our rates are going to be climbing as we more adequately define by testing who has it. But I suspect within about 2 weeks to a month, you will see dramatically dropping rates here in Seattle. That is a result of our keeping people away from each other. Okay. All right. So, and unfortunately, I think we're starting to see other areas of the country move more quickly to do that than what we did here in Seattle, because here in Seattle, we just didn't know we had it, okay? But out there, if you're already having people dying in your cities, you can literally take that and assume that for every person that dies, there are at least 1,000 people in your community. I'm sorry, did I do that right? There are at least 100 people per person that dies in your community. You can assume at least 100 people have it, okay? All right. So it's 1 out of 100. Yeah, you have at least 100 people. Every time somebody dies, there are at least 100 people out there that have the illness. Okay. All right. So I hope that answers your question. It could get bad, but we can limit it from getting bad. Okay. And yes, it means giving up a lot of our freedoms to move around as we've had to do here in Seattle. And we're in the middle of it right now. The streets are awfully quiet out there. Okay. All right. Thanks for that question, Doug. Hello, Diana. Let's see. I'm wondering if having Lyme, Babesia, and anaplasmosis makes one more susceptible to Wuhan virus. All right. So, Diana, I actually addressed this in my article. I'm going to show you everyone that article here in a minute. So I don't know. I'm not clear if it does or does not. So there is an impression among people that have, or it's true that people that have Lyme and tick-borne infections have some degree of immune dysregulation, okay? But does that mean that their immune system is dysregulated in terms of ability to handle virus infections? And the truth is, I don't know. No one's ever done the studies because this, the coronavirus is obviously something that is new to us here, okay? All right. So what I can reflect to you is what I know from the flu, all right? And that is what I see in my practice is that people that have Lyme tend not to get the flu any more easily or more readily or in higher numbers than the rest of the population does, all right? And also what I see with the flu is that people with Lyme tend not to have any worse outcomes than anyone else that gets the flu virus, okay? So if we look at that, I am not of a strong opinion that people with Lyme are going to have any worse time handling this than anyone else, but I will acknowledge it is possible, okay? All right, so those would be my opinions on that, all right? So let me just show everyone. So now we've had two questions. I just want to show you the article I wrote last week about that talks about my feelings on immune dysregulation and talks about measures you can take to not get this individually, which in addition to just trying to avoid going out there and being in contact with people, standing 6 feet away, it means washing your hands frequently, means staying home if you're sick, means trying not to touch your face so that you stop spreading it to yourself, and means getting away from people that are coughing or sneezing, getting at least 6 feet away from them, okay? And then I talk about immune boosting techniques too. So let me do a quick screen share here. All right. All right, so if you just type in coronavirus, there it is. There's my article. All right, and in here I talk about the death rate. I talk about how South Korea numbers suggest that that probably suggests a much lower death rate than others are reporting. I talk about what the person with Lyme could do in terms of do they have any increased risk of problems. And I talk about things you can do yourself to prevent getting it. And then I talk about ways to support your immune system that may prove helpful. Okay. All right. You can take a look at all that there. Thanks for the question, Diana. Good luck to you. Hello, Cece. Let's see. Dr. Ross, how can you tell the difference between symptoms that are caused by mold biotoxins and symptoms caused by Lyme and co-infections if there is a history and test results in both? You can't. I don't mean to be facetious here. Let me round that out a little bit more because ultimately you got to decide what you're going to treat. Okay. So, all right. So when you have Lyme and you have mold, there is a common thread behind both of them. And that is that having mold toxins build up in you and having Lyme or co-infections in you triggers your immune system to manufacture too many cytokines. Okay. All right. So what are cytokines? Well, cytokines are chemicals made by white blood cells, and they're good and bad. So when a white blood cell sees an infection or sees a mold toxin or sees too many yeast in your intestines, it tries to get rid of them. And what it does is it tries to activate itself. So some white blood cells will manufacture these chemicals called cytokines. Cytokines are good in that they turn white blood cells on. They cause more white blood cells to be made, and they draw those white blood cells to where the infection is, okay? And they draw the white blood cells to where that toxin is too, all right? So that's all good. But if the immune system is doing a hard time getting rid of mold toxins or having a hard time getting rid of Lyme and co-infections, it's going to manufacture more and more cytokines. And then you start getting cytokine excess. And cytokine excess can give you pain, can make you hurt all over, can give you brain dysfunction, can make you fatigued. You've got the idea. The symptoms that we call Lyme symptoms are actually too many cytokine symptoms, and the majority of symptoms that are mold toxin symptoms are actually cytokine excess ones too, okay? So The one thing that may cause me to lean more towards thinking mold is the possibility if I've got somebody with extreme neurologic hypersensitivities, like seizures, like severe cognitive impairment, I might lean a little bit more towards the mold side. However, I will tell you, if they have a lot of symptoms of Bartonella, then I'm going to lean back towards the tick-borne infection side too. Okay. So how do you figure out where you're going to go first? Well, you got to take a good history. You got to ask people, where were they when they got sick? What was it that changed in their life when they got sick? Okay. And so, for instance, there are times I'm talking to a patient that had a bullseye rash and got a tick bite, had a bullseye rash, and got achy at first, but then recovered, never got on antibiotics. And then they went and they lived in a house that had black mold. And it was when they were living in that house with black mold that they got sick. Well, I'm going to probably treat them for the black mold because that's probably what set them over the top. And it's very possible their immune system had the Lyme germ under control. Okay. So for instance, I've had a patient in my practice that came to see me that was having severe cognitive issues, severe fatigue, basically lost his wife, lost his kids, lost his job. I mean, it was bad. Okay. And one of my colleagues here in town had done Lyme testing on him, but had failed to take a good history on him and had determined that he had Lyme disease. He had solid testing. And that because of his severe cognitive decline, he needed to fly to Washington, D.C. to see Dr. Jemsek to get IV antibiotics. And he needed to do it now or he was going to die. I mean, that was the kind of words that she used. Okay. All right. So they wanted a second opinion. They came in to see me, and yep, he had a strong history of Lyme. I mean, he had very positive tests. I believe he had a history of a tick bite as well too. But as he was talking to me, I just said, and what else happened? I said, I know you were coaching football, and at a time suddenly you had to stop. Was there a point that things got bad? He goes, yeah, they got bad pretty quick. And I said, and what was going on in your life when they got bad really quick? And that's when I understood or learned that he had moved into a house that was found to have black mold. Well, I decided to start with the black mold. And so we did mold toxin testing, and we found that he was loaded with black mold. And yeah, he had those positive Lyme results too. But the story said he got sick only after he moved in and got his mold exposure. Okay. So I spent 3 months detoxing him. He got his complete life back. Now, his wife never rejoined him again, but he got his job back. He got his kids back. He was enjoying life and living fully. Okay. And all I ever did was I detoxed his mold toxins. I never actually went after his Lyme because I'm of the opinion that for some people with Lyme infection, they don't get Lyme disease. Their immune systems deal with the infection and they never get sick from that infection. Okay. That is possible. Okay. So the only way to really tell, there is not a symptom that would suggest more Lyme or more mold. A lot of the times the clue is in the history. Okay. All right. Now, at times it is not in the history. And then you've got to make a decision whether you're going to treat more for Lyme first or treat for mold toxins. And usually I try to engage my patients about where do they want to go first. I give them choices to consider about that. Okay. All right. Thanks for that question, Cece. Hello, Doug. Let's see. Can you tell us what your experience has been with Disulfiram? My experience with Disulfiram, so I've been working with Disulfiram now since I resumed clinical practice back in December. Many of you, I think, are aware that I had 4 years of fun with my medical board. I'll call it fun. Where eventually, after 3 years of fighting with them to keep my license to help people, I decided it just gotten to be too much. And they escalated an attack on me, which caused it so that I was now starting to second guess a lot of my decisions I was making with my patients. And I was making decisions more to please the board instead of doing the best thing for my patients. And so for a year, while my board was completing its work, I actually shut down my practice and moved to Austin, Texas. Okay. But my board eventually did go away. They held their noses at the fact that I treat Lyme and I use alternative medicine and decided they could not find anything legally wrong. And they let me alone. And so I decided in December to come back, or I decided actually in late September to come back, but I finally opened my office again in December. So when people started first working with Disulfiram, I was not in a place where I could work with it, okay? So I've been working with it now since December. So I've got about 3 months of working with it and a growing population of people that I'm using it with. I am having some people that are having some promising results on it, even with this short time. I've had people that have had some really good improvements. I am still, though, of the opinion that this is not going to be the drug that's going to help everyone, okay? And I still hold to that. There are some people that have had to have stop it because they've developed bad psychiatric side effects, which can happen about 15, 20% of the time. There are some people that are developing bad neuropathies and we're not able to manage them even using zinc and using other ways to help fix neuropathy. And so they have to stop it, okay? I'm having results similar to what Dr. Ligner reported. Ligner was one of the first doctors that started using it. In ILADS in Boston in November, he reported in his practice that of 31 patients in his practice that were using anti-abuse Disulfiram, about 6, he thinks, went into extended remission. About 5 had to drop out because of bad side effects, and the rest of the people had various degrees of improvement, okay? Now, Ligner was using Disulfiram alone, and that is how I started using it initially. After working with it alone, I'm now considering and actually starting to use it as a drug that I'm using to build a full Lyme disease treatment, okay? So, and let me explain why. So we recognize with the Lyme germ that there are 2 major forms of the germ. There's a spirochete, this thing that looks like a corkscrew, and that there are also microscopic cyst forms of the germ, okay? We also recognize that Lyme can live in biofilms, all right? Now, the majority of these cysts and the majority of these spirochetes are in a growing form, okay? And it's the growing form that most of the antibiotics that we traditionally use is most effective, all right? However, a small portion of those germs, we now know from research that's come out over the last 4 years, at least laboratory experiments, these have not been done in humans yet, but laboratory experiments show that a small percentage of the spirochetes and a small percentage of the cyst will turn into a persister form, okay? Is that an entirely new form? No, it's just some of the spirochetes assume a persister state and some of the cysts assume a persister state, okay? So what happens in a persister? Well, the germs actually slow their metabolism way down and they effectively go into hibernation. They stop growing, okay? All right, so as I'm now looking at this, I'm thinking we have growing spirochetes, we have growing cysts, and I need to use the traditional antibiotics to take them or traditional herbs to deal with them. And in addition, we should be putting everyone on something that deals with persister forms as well too, okay? So that means using Disulfiram, if we use that to treat persisters, along with a doxycycline and maybe a tinidazole, for instance, okay? But we need to build treatments, I think, that deal with persister. If we've got somebody we've treated 4 months or so more and they're not getting better, maybe we need to add a persister component while we still keep treating the growing forms of the germ, okay? All right. There are other things you can use for persisters besides Disulfiram. One of those is dapsone. One of those is an agent called methylene blue. There's another one called oregano oil, okay? The methylene blue, oregano oil have been shown on Petri dish experiments to actually work for persisters. Another drug that's been shown to help persisters is something we use to treat growing Lyme as well, to growing spirochetes, and that's something called ceftonir. It actually has been shown to help persisters too, okay? So more and more, I'm starting to rethink how I'm working with my patients and building treatments, and I'll report back to you over time if this is going to help at all, but adding a persister agent in addition to the ongoing antibiotics that they have somebody taking. Now, that's a little bit different than a lot of doctors have been using the Disulfiram. A lot of doctors have been following Ligner's example, which is to give a person Disulfiram after they've completed years of antibiotics, then just switch them over to Disulfiram and see if they get better. And we know from Ligner studies that about 6 out of 31 go into remission. I wonder, and I'll be able to report back to you in the future, what if we didn't just stop all their antibiotics, we left them on those other antibiotics addressing cyst and spirochete and put them on something to deal with persister at the same time? Are we going to get better results? We'll see. Okay. I'm also starting to look at the same idea with Bartonella. There's some research, new research, which has not been replicated, but there's a study that came out of Johns Hopkins that was published, I believe, in November, that in Johns Hopkins, they were able to create what are called persister forms of Bartonella. Now, I have no idea whether we actually truly have persister forms of Bartonella in humans because we don't have the studies that show it. But we have been able to show we get persister Bartonella in lab experiments too. And so especially right now with my patients that I'm having a hard time getting their Bartonella to improve, I'm adding agents to treat persister Bartonella. And those, based on Petri dish experiments, are methylene blue and oregano oil are the two that I'm using for that purpose, okay? We do not know if disulfiram is an effective agent for Bartonella. All right? All right. Thanks for that question, Doug. All right. Let's see. I think we can do this question from Nancy. Nancy, here we go. It's a long question, but I think it'll fit and I won't lose my whole webinar. Let's see how this goes. Yeah, it'll work. True. So I don't know until I actually formally post your question if it's going to lock my computer, but this is not going to lock my computer. So everyone, I would call this a long question. These are the questions that in general I do not like to take because they have the tendency to lock up my computer and they have the tendency to be hard to follow for people listening in, but I'm still going to try it anyhow. Okay? All right. Nancy, hello. So hi, Dr. Ross. Thanks for all you do. You're welcome. Let's see. I was treated with clarithromycin, rifampin, then rifabutin for about 14 months. Okay, so I think what Nancy is saying that rifampin or rifabutin was substituted for the rifampin. That's usually what we'll do. Okay, so clarithromycin and rifampin, and that rifampin was eventually replaced with rifabutin. Those two antibiotics, rifampin and rifabutin, are in the same family. Okay, they're substitutable with each other. All right. I stopped antibiotics this past September of 2019 because I had plateaued in symptoms but was doing okay with just leftover painful joints, rib cage pain, but functioning okay. However, in January of 2019, my son, also sick with Bartonella, tried to end his life. Oh, I'm so sorry to hear that, actually. Since then, I have begun to have an old symptom of night sweats that I haven't had for about 10 months because my treatments was working. When I stopped antibiotics this past September, I was put on Abart 15 drops, BLT 60 drops, Cemento 25 drops. My LMD has increased my Abart to 25 drops now twice a day since the sweating began. Do you feel this is sufficient to try to keep the Bartonella from coming back? I imagine all my extra stress over my son is suppressing my immune system. They also have me on transfer factors, the multi-immune 3 a day and the Lyme Plus 2 times a day. I take them all at night. Another issue is my CRP, which had been at 60 when I was at my sickest, is now down to 9, but still high in spite of taking Inflaquil, Cytoquil, fish oil, curcumin, Mariva by 500 by Thorn a day, lots of fish oil. I eat an anti-inflammatory diet with no dairy. Can you suggest something else to lower my CRP, which would hopefully transfer to less pain? Thank you very much. So I don't have any other ideas except using non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, something like that to lower your CRP, okay? You're already doing all the herbal anti-inflammatories that I would use, which is the Cytoquil, the curcumin, and fish oil can even help with that too, all right? All right, now just a comment about what's happened with here. Yes, stress suppresses the immune system, okay? But I would also want you to consider something before necessarily thinking that this is actually a Bartonella or a Lyme disease relapse, all right? And that is about 80% of the time that in my practice, 80 to 90% of the time in my practice, when somebody starts having symptoms that look greatly like a relapse, what I find under it is actually an overgrowth of yeast in the intestines. Okay, now I know that may sound kind of far-fetched, but just hear me out on this, all right? So remember I said that Lyme disease symptoms are really symptoms of too many cytokines, and even those too many cytokines can give you the night sweats too, okay? Think about when you get the flu. The reason you sweat when you have the flu is your immune system is just dumping cytokines out, and it's the cytokines that give you that temperature, okay? And the sweats that you get too, all right? So because you have been on antibiotics over a long period of time, you have disturbed your gut microbiome. You've disturbed the good bacteria in your gut. And there's now starting to be studies telling us that even a year, 2 years, 3 years, 4 years out, the gut microbiome never fully recovers. You never get back that great balance of bacteria. So that you are going to remain a setup for too many yeast, the yeast that live in your intestines overgrowing and starting to cause problems, all right? So, and if they do overgrow, there's a couple things that happen. Number one, they make a lot of toxins. And those toxins can get absorbed into your bloodstream. Some of them are neurotoxins, all right? So you can get more brain fog, you can get more of your neuropathies, for instance, okay? The second thing that yeast do is they trigger the immune system to overproduce cytokines, all right? And what do those cytokines do? Well, they make it so you can't think. They make you feel fatigued. They bring out your neuropathies. They give you brain fog. You got the picture, okay? So the first thing I would do is look to see if you don't have too many yeast before you rush back into a Lyme germ treatment, all right? And so things that could suggest too many yeast would be increased sugar cravings, increased gassiness and bloating, vaginal itching or vaginal discharge, sometimes having worsening every time you eat sugar. So if you have too many yeast in you and you feed them sugar or sugary things, they're going to party, and they're so to speak, and they're going to make you feel bad, okay? The other thing with these toxins that get released by yeast also can interact with your skin. And if you have too many yeast, sometimes you'll see people that have a lot more pimples or acne or their eczema or their seborrhea dermatitis. Skin conditions can get worse when you have too many yeast going on, okay? So time and time again, I have had people come into me that are scared to death that it is an overt relapse of their Lyme or co-infections. And if I see anything at all suggesting too many yeast, I often will not go after their co-infections or their Lyme for about a month while I try to do a yeast treatment, all right? So I want to throw that one out at you. All right, other things to boost your immune system if this is your Lyme germs. I agree with using your transfer factors, especially that L+. The L+ has transfer factors in it that turn on cells that fight Lyme, Bartonella, Babesia, Ehrlichia, okay? Basically your Lyme and the co-infections, okay? In terms of Bartonella, if you're going to try to do this using herbal options, generally, I am not enamored with Abart. I do think Sida acuta and Hutania can do a good job. They are found within your BLT. However, I usually like to use them as pure supplements by themselves, and those I would use as 30 drops twice a day, okay? All right, so maybe these herbal options can get it under control, but I'm asking to even step back further and make sure that this isn't too much yeast, okay? So I'm going to show you 2 articles that will help inform you about this as you're trying to figure this out too, all right? So I'm going to bear with me here. I'm going to get rid of your question, and then I'm going to do a quick screen share here. All right. So back here in my Lyme guide, take a look at the chapter. I think you can find it here in yeast. Take a look at my yeast chapter. All right. In here, I had the top 2 articles. One is how do you figure out if it's too many yeast, and the other one is about what do you do if you have too many yeast. Okay. All right. There's another article that you might be interested in looking at. It's called Steps to Fix a Lyme Treatment Crash. And this is where I make the argument that most of the time, 80 to 90% of the time, these are yeast overgrowth problems, okay? So you might want to take a look at that one as well too, okay? All right. Thank you for that question. Good luck to you. Hello, Lisa. Let's see here. Hi, Doc Marty. Would it be okay as a Lyme patient undergoing mold treatment to add antigraphis in slowly as an added respiratory protectant during the corona crisis? Would it hurt also to take 2 grams of vitamin C? Thank you, Lisa. So I don't think it's going to hurt. I'm just not sure it's going to do anything. All right. But I don't think you hurt yourself by doing it. Okay. All right. Thanks for that question. Hello, Dana. Let's see. How does Lyme testing determine if you have a chronic or recent infection? When I did IGenics testing 10 years ago, I was told I had Lyme disease for a long time. All right. Good question. All right. So, and I would tell you is there's not a good way. Even though somebody may have used those words, well, actually, let me speak. Let me clarify it. All right. So when we are doing a test like a Western blot, or IGenics now has a new test called an immunoblot, what we're doing with those two tests is we're looking to see if you're making antibodies that attack the germ, okay? And there's two families of antibodies. There's a family called IgM antibodies, and there's another family called IgG antibodies, all right? IgMs are what you develop with an acute infection, and they're supposed to go away by 6 weeks to 3 months, and then they get replaced by IgG. Once you develop IgG, they are the memory of the immune system. Because the IgGs are developed secondly, sometimes providers will look at the IgG, and if you have them, they're going to call it a quote unquote old infection. Okay. All right. Because always in an acute infection, you will be making IgMs. All right. If you're in that 6 week to 3 month window, somewhere in there, you should be making IgMs. All right. Now, here's the hitch. Every time that you make an IgM, though, does not necessarily mean it's an acute infection. All right. Remember I just said that IgMs get made and they're supposed to go away? Well, about 50% of the time that people have ongoing Lyme symptoms, or what I would call chronic Lyme, they still manufacture IgMs. They may manufacture IgMs and even IgGs, but about 50% of the time, even years down the road, even well beyond that 3 months, they are making IgM antibodies, okay? And it is a phenomenon that is known to happen. The infectious disease doctors ignore it. And if you've been sick for years and you come in with an IgM that's positive, they're going to call it a false positive because they're going to say it shouldn't be there. But guess what? It still is there. It happens to be there about 50% of the time. And we know this because when there were a number of studies sponsored by the NIH last decade that were designed to see if long-term treatment of antibiotics would work. And in those, they're trying to find patients. They were doing antibody testing for IgMs and IgGs, and they found in their studies that approximately 40% of those people, or 50% of those people that had chronic Lyme, were still making IgMs. Okay, now they didn't publish that, but when you go back and look at the data, that's what you can infer from the data. Okay, so we don't know why that happens, though. There's theories as to why it happens, but we don't know why it happens. All right. So it is true. You could say if you've got elevated IgGs that you must have had this for at least 3 months or more. But I don't think I would necessarily call that long-term. It just means you've had it for 3 months or more. Okay. All right. And again, if you've got an IgM there, it could either be from acute or chronic infection. All right. Thanks for your question. Hello, Vicky. Let's see. Is there a diet plan that you recommend when you have Bartonella, Lyme, and Babesia, as well as mold? I have major food sensitivities and keep getting contradictory diet suggestions. All right. So my favorite diet in these situations is to use a plant-based, healthy paleo diet. That's a lot of words there. So a paleo type diet, you can find all kinds of paleo. There's some paleo diets that are basically all about eating red meat and fat and eggs, okay? But you can also find paleo diets that are very much more based on having a good mix of healthy vegetables, limited fruit, and emphasizing healthy protein sources, okay? And so if you do that type of a diet, it is anti-inflammatory. A paleo type diet like that also is supportive of the energy factories in our body called mitochondria. And because a healthy paleo diet like that does not use a lot of fruits and does not use a lot of simple sugars and does not use beans, legumes, and grains, it's not having a lot of carbs that are going to feed too many yeast that could develop in your intestinal tract from being on antibiotics as well too. Okay, so let me show you an example of what I'm calling a healthy plant-based paleo diet. Okay, and I've got the resources on my site about it. Okay, all right. So let me do a quick screen share here. All right. So this is back at my Lyme disease information site. Take a look at my nutrition tab here and take a look at this article called The Best Brain Inflammation, Pain, Energy, and Detox Diet Ever. All right. This is an article that uses resources that I got from the Institute for Functional Medicine with their permission. And it is their diet, which is called a Mito Food Plan, which is a plant-based paleo diet, okay? You'll have to read the whole thing here. I tell you how to figure out how to work with it. I provide you all the documents from the Institute for Functional Medicine, okay? All right. All right. Thanks for the question, Vicki. Good luck. Hello, Vicki, again. Let's see. Is it common to have blood pressure issues with Lyme? Usually not high blood pressure, but sometimes people with Lyme have infection that infects their vagal nerve. The vagal nerve is the adrenaline, anti-adrenaline nerve. It controls your balance of adrenaline, anti-adrenaline. And so therefore, sometimes people have a hard time keeping their blood pressure up, okay? But usually it's not high blood pressure problems that people have, all right? All right. Thanks for the question. Hello, Margaret. Is there a rash that looks like a cat scratch characteristic of Bartonella? Yes. So Bartonella, one of the things it can do is it releases enzymes that can break down tissues that hold things together, okay? So it can break down connective tissue that holds your skin cells together. And so what it can look like in the areas where it has broken those tissues that hold skin cells together is it can look like really thinned out areas of the skin, which looks like scratch marks, okay? So Bartonella is known to do that, okay? Hold on here a minute, everyone. I just got to get some water in. Hello, Chris. Let's see. Hi, Marty. Taking azithromycin, which is giving me diarrhea despite doubling probiotics last week. Would you recommend prescribing Bactrim? Thanks. All right. So, Chris, in a situation like this, what I would do is I would temporarily stop your prescription antibiotics. And that would, anything you're on, whether it's azithromycin, rifampin, anything that you're taking that is a prescription antibiotic, stop them for 2 days and see, does the diarrhea go away? All right. If it does, it's an antibiotic related diarrhea. If it does not, then it then it is possible that you might have developed something called a C. difficile infection, or C. difficile overgrowth, I should say. So C. difficile, also known as Clostridium difficile, is a bacteria that normally lives in all of our intestines. But when a person is on antibiotics, it can cause that bacteria to grow too much. And it makes an enzyme called C. diff toxin that we can actually test for. And that enzyme can sometimes lead to just a number of watery stools a day, basically, okay? But my approach usually isn't, because I see so often that it usually is more of an antibiotic side effect giving the diarrhea. My first approach is to just stop the antibiotics. My first step is increase probiotics. And if that doesn't solve the problem, then I will do a trial of stopping the antibiotics for a couple of days just to see if the diarrhea goes away. And if it does not, then I want to go ahead and do C. difficile toxin testing. Okay? All right. Good luck to you, Chris. Thanks for the question. Hello, Katie. Let's see. Dear Dr. Ross, can you please recommend what supplements can be added to conventional medicine for treating osteosarcoma following Lyme? Any suggestion where I can find information about holistic approach? Thank you. Katie, actually I don't know what would be a good way of doing that. And I would have to do what you would have to do. I would just go ahead and do go to something called PubMed, PUBMED, which is run by the National Institutes of Health. It's a search tool, okay? And what I would do is write in herbal medicine treatments for osteosarcoma, do that as a search and see what pulls up. And then I would also look at supplements for the treatment of osteosarcoma. I would do those kind of search terms, okay? All right, good luck to you. Hello, Molly. Let's see. Hi, Dr. Ross. I was diagnosed, doctors did a urine sample with DMA provocation with quite high lead, moderately high in mercury. In your experience, how big a role has heavy metals toxicity placed in thwarting Lyme treatment? And what is the best way to chelate detox heavy metals? Thank you ever so much for your generous help. So, Molly, I used to do heavy metal testing pretty regularly on most of my patients with Lyme. And in general, I have been disappointed at the benefit they got from it. So in general, I don't find much benefit from doing heavy metal detox with most patients, okay? How I do it, my approach now is if I'm treating somebody and I'm using my full Ross Lyme support protocol, and we're about 9 months into a treatment or even a year into treatment and they're not getting better, I might then start looking for heavy metals as something that might be holding them back. The other times that I will look for heavy metal toxicity more upfront is if I'm about maybe 3 months, 4 months into treatment, and somebody's got neuropathy and that neuropathy is not getting better. And those situations, I might start looking for heavy metal toxicity as well too. Okay, all right. In terms of what's the best way, it varies, is very person independent. I do believe that for most people, you can do just as well doing oral chelating agents as you can IV chelating agents. Okay, all right. Thanks for your question, Molly. All right. Hello, Mark. Or hi, Mark. Let's see. Hello, Doc. With my history, I was told if I received 100% with my system, I would need to be on a binder for the rest of my life. Would I have had to take 3 to 4 scoops a day after recovery or down to 1 scoop a day? Also with Lyme, I use Banderol and Cemento after recovery. Does someone stay in a maintenance dose? Thank you, Doc. All right. So when somebody has mold toxicity issues, and so if you are a person that has filled up a lot of mold toxins in you, we know that your system is one that is not programmed to be able to remove those on your own, okay? And because we cannot always control the environment we live, and we can control our home, we can live in clean homes that don't have mold toxins in them, but we can't control what's going on in our churches, and we can't control what's going on where we get our food. I mean, it's very possible that you can run into mold toxins out there. So for that reason, I often find, even after I get somebody well, doing an aggressive mold detox, that often I'm going to need to leave them on lower levels of binders to keep up with what's coming at them from their community, okay? So for instance, that might look like instead of doing cholestyramine powder 3 times a day, I have them do it 1 time a day, okay? All right, so that's an idea about that. Also, for some people with chronic Lyme, we do need to leave them on suppressive doses of herbal or prescription antibiotics to keep those germs from coming back. Usually, though, I'm not going to do that unless somebody has relapsed at least 1 time. Okay? All right. Thanks for that question, Mark. All right, everyone. That's it. I'm kind of pooping out, and we're only a few minutes away from being done anyhow. So I'm going to call it. I'm going to call it for tonight. So I've had a good time being here with you, and keep your eyes out in the email tomorrow morning, because in tomorrow morning's email, you will see information about how to sign up for next week's webinar. After next week, I will take the week after that off. Okay, so we have 1 more this month, and then I take a week off. Okay, all right. It looks like my new webinar platform is finally working. We've been able to do 2 of these in a row, which is good. I'll soon see if the recording part of it worked. So yes, tomorrow morning, somewhere between 9 and 9:30, keep an eye out in your email, and you should get an email giving you an indication that the webinar recording has been edited and is ready for you to review as well too. Okay, all right. I look forward to seeing everyone next week, and good luck, everyone. Take care. Bye-bye.